Hi. As an interventional cardiologist and interventionist, I do both vascular and cardiac intervention. I take care of a lot of patients with blood clots, DVT. I've been doing this for 25 years. I dissolve the clot, remove the clot, put a stent if needed. And what worries me now that since this COVID-19 pandemic, people who had even mild COVID symptom or severe COVID symptom, they've been getting more blood clots. We're seeing more and more DVT, more and more blood clot in the lung, legs, and even in the brain. And this is new, this is more, and this is very worrisome for all of us because we are seeing two things. Number one, there's an increase in DVT cases, increase in pulmonary embolus, which is blood clot in the lungs, as well as stroke in people with the COVID time or COVID-19 era. Some of them had a COVID and they didn't even realize they had a COVID. And those are also vulnerable to get more clot formation. It is very amazing and interesting that this small little virus has created so many different pathology which we're still trying to understand. One of the issues is it creates inflammation in the microcirculation. And when there is inflammation in microcirculation, that increases the clot formation. And this clot formation can get more aggressive, more extensive, and can give us the DVT or pulmonary embolus, what we call PE, or stroke. And the other issue is these clots somehow not only very aggressive, not only they're extensive, but they're hard to treat. They're not like run-of-the-mill DVT. They're a little bit aggressive. The amount of blood clot is maybe more, or maybe they start so slowly and they get organized so that it is difficult to treat. Usually when somebody comes with blood clot in the past or extensive blood clot, we can go and put a catheter inside and we can remove the clot within 8 to 12 hours of clot buster or TPA, or we can go and extract the clot out. This is not that easy nowadays because this aggressive form of extensive slow building clots are so organized so that it's hard to remove whether with the clot buster or removal with a catheter. So it's becoming a challenging for us. And the only thing I can tell please get vaccinated when you get chance. When your number comes, don't delay it. People, I know there is a lot of theories about not taking it. A lot of people hear something. I can only tell you, the science is not designed to harm people. They are there to help people. Yes, there is nothing we do in this world is 100% perfect. But I can tell you, your chance of making with vaccine is much higher than without vaccine. So I think please respect, even after getting vaccine, you still have to remember to social distance, mask, whatever required. Use common sense, Please just don't put your life and your family or loved one's life in misery. That's the only thing I can tell you about blood clot with high risk people with pandemic COVID-19. Thanks.